Urinary bladder, it is a subperitoneal hollow muscular organ that lies in the lesser pelvis. Situation: it is situated in the anterior part of the lesser pelvis behind pubic symphysis. When the bladder is empty, it lies within the pelvis. When distended, it expands into the abdominal cavity. Shape: when the bladder is empty, it is tetrahedral in shape, and when distended, it is ovoid in shape. Capacity: the mean capacity is above 220 to 250 ml. External features: the urinary bladder has an apex, a base or posterior surface, a neck or inferior angle, three surfaces: superior surface, two infrolateral surfaces, and four borders: anterior border, two lateral borders, and posterior border. Apex: the apex gives attachment for median umbilical ligament, that is a remnant of urachus. The base or posterior surface, it is triangular in shape and it is related to seminal vesicle and vas deferens in case of male, and it is related to cervix of the uterus in female. Neck: the neck is pierced by the urethra and it is related to prostate gland in male and urogenital diaphragm in female. Surfaces and borders: the two infrolateral surfaces are meet anteriorly at the anterior border. The two infrolateral surfaces are separated from the superior surface by lateral borders, and the superior surface is separated from the base or posterior surface by the posterior border. At the superolateral angle of the urinary bladder, it is pierced by the right and left ureters. Relations: in male, the urinary bladder is related anteriorly to the pubic symphysis, posteriorly in the lower part to the seminal vesicle and vas deferens, in the upper part to the rectovesical pouch, that is between the rectum and the vesicle, that is the urinary bladder, there is a gap or a space known as rectovesical pouch. So posteriorly it is related to seminal vesicle, and medially the vas deferens in the lower part and the rectovesical pouch in the upper part. Superiorly it is related to coils of small intestine. Inferiorly it is related to prostate gland. In case of female, it is related anteriorly to the pubic symphysis, superiorly to the coils of small intestine, posteriorly the uterus is present here. So posteriorly it is related to cervix of the uterus and vagina. So between the urinary bladder and the rectum, the vagina and the cervix is present. So posteriorly it is related to upper part of the vagina and cervix of the uterus. This in turn separated from the urinary bladder by a gap known as, between the uterus and the urinary bladder, the gap is known as uterovesical pouch. So in case of male it is rectovesical pouch, in case of female it is uterovesical pouch. So the anterior and the superior relations are same in case of male and female, whereas the posterior and inferior relation differs. Inferiorly, the urinary bladder is related to urogenital diaphragm in female. Interior of urinary bladder. The interior of urinary bladder is lined by mucous membrane which is thrown into irregular folds known as rugae. The mucous membrane lining the internal surface of the base or posterior surface presents a triangular area where the mucous membrane is thin and smooth, that is the foldings are absent. It is known as trigone of urinary bladder, which is limited superiorly by the openings of the ureters and inferiorly by the opening of the urethra. So this triangular area is present between these three orifices. Blood supply. The urinary bladder is supplied by superior and inferior vesical arteries. Venous drainage, it is drained by vesical venous plexus, which in turn drains into internal iliac vein. Lymphatic drainage, the lymphatics from the urinary bladder drains into external iliac lymph nodes. Nerve supply, it has both sympathetic and parasympathetic nerve supply. Parasympathetic is by pelvic splanchnic nerves. Sympathetic is derived from T12 to L2 segments of the spinal cord. Clinical anatomy. Suprapubic cystostomy. It is an extraperitoneal approach to cut the cavity of the urinary bladder, that is to open the cavity of the urinary bladder. It is done for drainage purpose, removal of vesical stones and removal of prostate. Trabeculated bladder. It is a condition in which the urinary bladder becomes more distended due to hypertrophy of the muscle wall or the muscular coat of the urinary bladder. It is due to chronic obstruction of the outflow of urine by enlarged prostate or stricture of the urethra, that is narrowing of the lumen of the urethra. Thank you.